Well, the months of November in Nigeria are indeed across the West African coast usually characteristically cold with dry winds, and the reaction of that change in weather condition varied depending on where you are actually. Well, we're now being joined on News Track by Dr. Yetunde Abatan, a public health physician at the Lagos State University Teaching Hospital. Thank you for joining us today, Dr. Abatan. Well, this season characterized by cold, dry winds with lots of haze in the air, but could there be any health implications for this?
Well, the major health implications of the Harmattan is usually on the eyes, on the respiratory system, on the skin, and even on the systems of the people. Most of the times, people with when there is Harmattan, people tend to have things like chronic cough, asthma, bronchitis. That is on the respiratory system. On the eyes, they tend to have things like conjunctivitis, and people with allergy, especially those with asthma, are more prone to diseases during the Harmattan period. Also, people are more prone to having respiratory tract infections because the ciliary muscles in the nose, the cilia in the nose tend to be dry, and when they are dry, they tend to make people have more infections. So people are more prone to respiratory tract infections during Harmattan. Also, the skin tends to be chapped, and then people with sickle cell anemia, they tend to have more crises during Harmattan. And this is because the solubility of the oxygen is low, and then they tend to have crises and they get dehydrated. People also tend to have things like heat stroke during Harmattan. So those are the major implications, the health implications of Harmattan.
All right, well, since it looks like these illnesses you've mentioned now are kind of unavoidable, what should people be doing to avoid or to help manage this situation when it comes?
The major health implications, like I said, have to do with dust in the air. So the major thing people need to learn is to actually control dust. They need to wipe the surfaces of their houses with wet things so that the dust is controlled. They also need to wash their curtains. They need to, people that have asthma tend to get more attacks when they're around fluffy rugs and pollen grains. So they need to stay in a controlled environment. So those are the things. Then people with allergies need to also, know that they have allergies and stay away from the triggering effects of those allergies. Then people need to also cream themselves with moisturizing lotion and all of that so that they can be well protected from the environment.
Would it be out of place for health professionals or agencies to advise the authorities that perhaps to come up with some sort of vaccination for the season to ensure that perhaps those who contract or come down with flu or any of such seasonal ailments don't spread it?
Well, I actually also forgot to say that one of the major diseases during Harmattan is cerebrospinal meningitis, and this is usually found up north. So one of the things the government does to make sure that the Harmattan doesn't affect a lot of people is that they gear up immunization at this time of the year for CSM, that's cerebrospinal meningitis, because it's the time when it's at a peak period. So they do a lot of CSM immunization at this time of the year, but they don't really do a lot of flu immunization at this time, but they do a lot of CSM.
Okay, Dr. Yetunde, I know things like this, like I said earlier, are unavoidable. Even I have the flu at the moment, but sometimes you take this medication and they don't just work for you.
Okay, well,
like mine has been on for about a month now, and it doesn't look like anything is working.
Another thing again is that people need to know is that they need to increase their immunity at this time. They need to take more things like fruits and vegetables. They need to be well hydrated, because those are the things that make your body to be well protected from the effects of Harmattan. You need to take more fruits and vegetables, vitamin C, and all of that. Those are the things that make you well protected. And then also, if you've had it for a while, then you actually need to also visit the doctor and get proper medication for this as well.
So ordinarily, do people have to wait until they come down with anything, or for the authorities to put up a notice for them to come forward or go to any of those health centers before you come down with anything?
Like I said, people at this time, because of the effects of Harmattan, people at this time need to actually increase their immunity. And they can do this by taking fruits and vegetables and getting well hydrated. They don't really need to take any other thing at this time, but just be well protected.
All right, Dr. Yetunde Abatan, thank you very much indeed for talking to us on the news today.